Good afternoon, everyone. Gareth Presh, founder and CEO of the World Health Innovation Summit. Delighted to welcome you to WHIS 2024, our afternoon sessions. Firstly, we're going to talk about digital health with a particular focus on AI and space medicine. I am delighted to welcome my guests here today, esteemed panelists, I may say, good friends from around the world. Certainly on the other side of the world, we have Dr. Shauna Padea, Ben, who's joining us from the UK, Carl, who's US stateside just after Thanksgiving, and of course, Professor Piero Formica. Let's just do a quick round of introductions, and let me just start on the other side of the world, and ladies first. Shauna, you're very welcome. We've known each other for quite a number of years. Please, a short introduction to our audience.
Yeah, first of all, thank you so much for having me on this panel. I wear a number of hats. I'm a rural emergency physician in Canada. I'm Canada's first commercial female astronaut. I'm the director of the International Institute for Astronautical Sciences Space Medicine Group. This is the institute through which I'll be flying to space aboard Virgin Galactic. And I'm also the director of the IAS Flight Opportunities Program.
Thanks, Shauna. And let me go all the way to Italy in Europe. Professor Piero Formica, who is also a fellow of the Royal Society of Arts. Piero, a short introduction.
Well, so you asked me to talk about the transformation due to the new technologies. So my first impression, I give you an image. Try to take a look at the Justus von Liebig barrel and the law of the minimum. There is a barrel, the law of the minimum. He said that the shortest stave determines the amount of liquid that can be contained in the barrel. Now, in my view, concerning One Health, the culture, which I call economic humanism, which means the economists are social philosophers rather than merely accountants. The culture of economic humanism make a difference. Is the intangible asset, the shortest stave in the metaphor of the barrel.
Thanks, Piero. And let me go over to the States. Carl, if you could give us a short introduction and let people know who you are and what you do.
Sure, Gareth. Thank you so much for being here. It's a pleasure. My background has been in venture capital, family office, mergers, acquisitions, and tech, often serving as a translator between internal and external tech teams and executives who had different types of challenges. And when it comes to space, I worked with the Rocket Racing League, ran merchandising and apparel for them, which was like NASCAR in the skies with rocket-powered planes. On the healthcare side, I helped put together a deal between Microsoft Health Vault and the first online HIPAA-compliant platform for the exchange of electronic medical records. And I ran AI SWAT teams for a company that beat out Palantir and C3 to win in other areas. Pleasure to be here.
Thanks, Carl. Ben, it's a pleasure to have you join us. A little bit of a background about yourself.
Yeah, thanks, Gareth. It's great to be here with everyone on the call. So my background has been in musculoskeletal health and the delivery of community rehab services. Over the last 10 years, been combining technology with community spaces, whether that's faith spaces, swimming pools, care homes, retirement centers, to deliver health and wellbeing services. Bridged using technology and AI, but enabling those community-delivered service with often a goal to overcome the barriers for health inequalities.
Yeah, and I think that leads us very nicely into our opening question, and I'm going to put that to Piero. AI has incredible potential in healthcare. We're constantly hearing about this opportunity. What do you see as the most transformative applications of AI in health and well-being? I think this would be a key topical area.
May I?
Please.
Yeah. So, as I said before, I try now to explain what I mean by economic humanism. My idea is that we must reframe how we treat the data in economics. If we don't this, One Health is lost in the desert. which means we need to anticipate, to give a priority to development, which is a quality issue, rather than to the quantity issue, which is called the growth. Quality issue, which is, I come back to my point, development, means One Health, which implies social justice, environmental sustainability, and the ethical behavior. These are three ingredients for the recipe of One Health, which is not only prevention of our health, is a way of living, is a way of thinking. Otherwise, using the usual metrics of GDP, never we can get any fruitful outcomes from One Health. So overall, I call this environment the cultural environment. I come back to my point of economic humanism. Technology, they have to follow the principle of ethics, of sustainability, the nature, the animal as sentient persons, quoted persons, not rather animals, rather than animals, and not less important is the issue of the capability of enhancing the education and the science as a force which liberates us from conviction, prejudice, and so on and so forth. This is my personal view. Under this scenario, or inside this scenario, there is what I call in Latin homo solidaris, the solidarity among persons, between persons, animal, and nature. At this point, I stop here and I prefer to listen to my colleagues.
Thanks, Piero. And this is where we go to Ben and we ask Ben how, what Piero's describing, how can digital health tools bridge the gap in healthcare delivery and improve healthcare access in underserved areas? I mean, you're at the forefront of this in the UK.
So I think what was put forward in terms of cultures and communities and their impact on health behaviors and access and health services. So looking at underserved population in terms of my area around musculoskeletal health, conditions are not experienced equally across populations. Within musculoskeletal conditions, there is a much higher prevalence, which is linked to economic deprivation, age, higher prevalence in women, and more disproportionately affected in some ethnic groups. Now, for musculoskeletal conditions, is a very broad topic, but there are many things that people can do to manage the condition and prevent it. But we act similar to a lot of public health messaging campaign, that if you tell people to improve their health, do these activities, engage in these services, they will improve it. The problem is it's not that people don't know better about what they can do to improve their health and well-being, particularly musculoskeletal health. We all know what is better for us. We know you should be moving more, being more active, having a better diet. Is that we don't do better, even though we know better. It's not a knowledge deficit, it's a behavior deficit. So this is where technology delivered in community spaces can really overcome that behavior deficit, because engaging with healthy activities and engaging in health services is usually linked to pre-existing ideas of how someone should engage with a health system, when or where they should engage with it, and how often. Now, a lot of behavior is driven by social connections and social drivers. So by utilizing existing community spaces that people already engage with, they trust, faith spaces, libraries, churches, community halls, leisure facilities, swimming pools, it means that you break down some of those barriers that people traditionally have to engage with health systems and traditional health venues. Now, these spaces are community assets, both the physical asset in where they are, but also the human asset in the people working there, the volunteers, and the social capital that they have as spaces. Now, when you can implement digital technology to start delivering health and well-being services, which is safe and effective, it means you can utilize and bridge using that social capital, community assets, to then deliver these health services on people's doorsteps. So we've been running a program in the UK over the past couple of years called MSK Hubs, where we implemented digital technologies and artificial intelligence into leisure centres, gyms, swimming pools all across the UK to create brand new services that were built into existing traditional pathways within health and the NHS. We had some great outcomes in terms of social return on investment, in terms of people improving their health outcomes from pain, physical function, overall quality of life. There were no clinicians in these community spaces, but it was digital technology bridging the gap. And we know from some of the data wider over 5 years of delivery of a program that I run, Good Boost, that we're also breaking through those key areas of health inequalities, reaching a high population that are living in low-income neighborhoods, reaching a high population of ethnic diversity, because they trust the venue. They see people there that look like them. They see adverts and hear people talking about it over coffee, and they realize that these are spaces they can engage with to manage their health when they wouldn't necessarily engage with digital technology at home, because they need that support of the community and a trust bridge to engage in these services and activities.
Yeah, brilliant, Ben. And quite a lot of people won't realize that a lot of the technologies that you're talking about are actually developed in space. So if I go across the world and I talk to Shauna at the moment, space medicine has given us unique insights into health beyond Earth. Do you know what I mean? That's your focus on that now. But a lot of what Ben is actually talking about has been developed by astronauts in space. How can this research translate, which you're working on at the moment, into healthcare innovations on Earth? Because this is an emerging field. This is something myself and yourself have spoken and talked about for about 8 or 9 years now.
Yeah, that's a great question. So thank you so much for that. And so oftentimes throughout my career, I have heard time and time again, but what has space done for me lately? And, truly in this day and age, we cannot get by without space-based technologies, whether we're talking about telecommunications, whether we're talking about GPS and how that supports our whole banking system and our supply chains. And then specifically to my field, the world of space health and space medicine, and truly, as I try to make the case and evangelize on, is there's a whole space health economy that can support both astronaut health and the emerging low Earth orbit or LEO sector and the cislunar economy, but also bring those returns for Earth. So when we talk about what space health has done for us, we talk about 3 areas. So first of all, there's spin-in potentials, so spin-in and then spin-off potentials, and then space-based innovation. So when we talk about spin-in or spin-off, we either talk about what technology, what research and innovation, what developments we have learned from the space environment. We can also talk about remote and rural and austere and resource limited environments on Earth and how technology is developed for our most rural and remote communities, how those can support astronaut health, and then finally leveraging the spaceflight environment, specifically microgravity, to address our greatest challenges in healthcare. So for example, I'm currently in Australia, but I am Canadian. I do live in Canada. The Canadian Space Agency has a mandate to support health, especially with astronauts in rural and remote communities. 17% of Canadians live rurally, and that means they live away from the bells and whistles of a tertiary care hospital. And I know because I'm also an emergency physician, and when I'm not doing the space medicine and human spaceflight gig, every weekend and holiday, I'm in a rural emergency room, and I know firsthand that I don't have more than a rudimentary X-ray machine. I don't have necessarily a CAT scan machine. I don't have bedside ultrasound. And so one example of these technologies, I work with a Canadian company called Luxonic Technologies, and through funding from the Canadian Space Agency, we have developed the world's first mixed reality point of care ultrasound machine. And so basically this form factor, it's lightweight, it's low power, it's easy to use. And so that has applications for both rural and remote healthcare, as well as astronaut health in space. So that's one example of dual application technology. Speaking to the other side of what we can do with access to space and microgravity, off-world biomanufacturing is becoming a huge area of interest, and I'm seeing more and more pockets of interest in investment in this across the world. And there's new accelerators even dedicated to space health. And so look at case studies in pharmaceutical manufacturing and drug development. So there's a case study where Merck, the pharmaceutical company, developed Keytruda, a key chemotherapy agent, in microgravity. Why did they do that? It's because protein crystals grow more slowly, larger, and symmetrically in the microgravity environment. So if you are a patient on Earth who needs Keytruda as a chemotherapy agent, typically going into a hospital and you are giving a day of your life to get an IV infusion. This new version of Keytruda is more shelf stable, such that it doesn't need to be refrigerated and it can be administered subcutaneously or under the skin. So that means that you can inject this yourself or in a doctor's office, or you don't need to refrigerate it, which has huge implications for giving patients their quality of life back, and also making this drug more accessible to people in places that wouldn't normally have it. Regenerative medicine is already a multi-billion-dollar market on Earth. So now there are entire consortia looking at regenerative medicine, stem cell therapies, 3D printing, organoids on chips, and using that as a model for disease, pathophysiology understanding in space, and accelerated aging, and bringing that back to Earth. And when we look at the economies that come back with that, the current regenerative medicine market in space is projected to reach 3 billion over the next 10 years with a 25% annual compounded growth rate increase. So these are just examples of what space can do, and we're limited only by our imaginations, especially with the fact that we are now getting better mass access to space with the rise of reusable launch vehicles, as well as being able to decrease the cost per kilogram of what it takes to get to space. So I hope this piques a lot of good discussion and a lot of people's imaginations, because truly we do at my institute, at WHIS, and I want most scientists, practitioners, medical experts to think of space as the next great research laboratory.
Absolutely. I think you've just highlighted some of the opportunities. I mean, they are vast. And as you say, it's really down to the imagination. I think one of the barriers that we face with adoption for space medicine and AI is around the ethical questions. So just Carl, from your experience, I want to come to you next. Like, what are the ethical and privacy considerations when integrating AI and other digital tools into patient care? Because this comes up, Ben will know, Piero will know, Shauna, time and time again. I've had it myself when I worked in the National Haemophilia Council about privacy, access to records. How can we integrate AI into this new economy and also then capitalize on the opportunities that Sean has just outlined?
That's an excellent question, and it's one where there's a lot of tension between two primary areas. When you take a look at policies, on the one hand, you've got your HIPAA, you've got your GDPR, you've got your GINA, the Genetic Information Non-Discrimination Act, the Declaration of Helsinki. You could go on and on and on. So you've got these policies, these protocols that are coming into place, and everybody's trying to figure out, how do we navigate this from the regulatory side of things? And then on the other side, you have the human beings, right? So what I like to think of, I was at an event, a friend of mine had a book launch, and it was one of these moments that was really telling, when all of a sudden you see your picture on a step and repeat on Getty Images, and you realize that, do I really own my own image here, content? Who actually owns this? So the photographer that takes the picture, right? They're the ones who usually get the rights to the image and the information, the data. And then there's the subject being photographed. What rights do they really have? And that's where this tension comes together between the regulatory side of things, the ethical considerations in the middle, and then the human beings. And a lot of times, if you don't take a human in the loop type of approach and go human centric first, then you can often run into situations where you don't have enough data to really accurately understand. So you're using a smaller population to be able to predict, and you have people that are left out on the fringes. You can also have situations where bias starts coming into play. I mean, when it comes to space selection, for example, the questions of genetic predisposition and what that could actually mean in terms of an astronaut. But then a lot of people might not realize that because astronauts are public figures, there's a duty of care from space agencies, not only to take a look at the short term, but the long term effects. Well, the population information or the information genetically about this astronaut could lead into other things that affect the family. So then there's the de-identification of information, the ability to take data and be able to reverse engineer and pull back different components and correlations that were deliberately separated, anonymized, and taken into consideration in order to be able to protect the individuals. There's an organization, a mental telehealth organization. We actually paired it with an AI company where I ran the SWAT teams and took top 5 North America this year in the 2024 AI for Good competition with the UN, which was really exciting. But one of the reasons why I agreed to serve on that advisory board was to protect the brain scans that we're capturing and the data that's there, which is so important to make sure that the patient doesn't get taken out of the equation, but is really factored in, controls that, and then therefore can collaborate and influence the direction. So when we come back to ethics, Professor Piero was talking about GDP. And are we taking a look at things from a GDP type of standpoint? Are we taking a look at things from an economic standpoint, an impact standpoint? Or is there a way to actually take ethics, economics, impact, and be able to come up with new ways of being able to break through? And I think space actually presents a great opportunity for us to be able to come together in the human, as a human race, at humanity, at the level of humanity, and be able to bring more people into the equation to be able to go and solve these challenges and look at this as the undiscovered country versus the final frontier.
Yeah, and I can also give some practical examples. I mean, when I worked with hemophilia patients years ago, we gave them a card, which they presented at A&E to basically tell the clinician to treat immediately with factor concentrate. In many cases, like you say, if you don't have that humanistic approach, you end up with a patient who may ultimately die due to the fact of not actually taking action immediately, because you can't wait. Do you know what I mean? That privacy barrier, because it's not so crystal clear in health sector. You've got to be able to do things immediately based on the patient's need. And this GDPR or privacy may actually cost people their lives. So, I totally see the real life consequences of not taking this action. Piero, if I come to you, I have a question for everyone, actually, just to get your thoughts on this. What role do you see digital health playing in, like we talked about, personalized medicine and healthcare, and how can that support preventative care? So how can digital health support preventative care?
Okay. My view on this subject is in some way non-conventional. I think that the number one, the very relevant issue is to build well-made heads, not well-filled. This was Montaigne who said this, okay? So first of all, we have to transform education from memorizing to augmentation. Why we talk about to augment the artificial intelligence? Not many people, they talk about to augment the human intelligence. Nowadays, we have today I wrote on the Financial Times about this new robot filled with a microchip, artificial intelligence inside the human intelligence. Okay, but this implies we need to defeat the usual conventional education to generate this well-made ads, which means, practical term, most people, they live inside technology with the usual knowledge map. It's like Ptolemeus. I have my Ptolemaic knowledge map and I follow the knowledge map. I call these people Ptolemaic knowledgists. We need to defeat the map designed by artificial intelligence. Otherwise, we copy and paste from artificial intelligence. This means we ruin, is a curse for humanity, is the tragedy for the humanity. So, process of discovery. We don't need experience. We need experimentation. Make experiment, which means the what's, the why's, the house, I am doing this or I am doing that. Otherwise, what's happened? That the human is like the PlayStation. No? The guy invented the fire, bye the others. This is ridiculous. But the status quo is the law of gravity of the status quo is so strong that I doubt if we can reach this result. During the COVID time, the Nobel Prize in Economics, they challenged again the GDP, but then nothing happened. In Europe, the GDP is the titan. It was a modest small animal in the 30s of the last century when Professor Kuznets invented the GDP. And nowadays it's a titan. And this doesn't happen, the experimentation. We need to be expert in the existing knowledge maps. But nowadays, the human knowledge maps are wrong. This is the issue. We need to create new maps. It's up to us, the creativity. We can't lose the creativity. I wonder about this. I don't know what we can do.
Well, I think actually that's why I want to go to Ben, because I think Ben is actually at the forefront of this experimentation, because Ben's doing it from a digital health perspective with Good Boost Learning. And this is some of the models we've been talking about. Ben, what role do you see digital health playing? I mean, Piero's talking about we need a paradigm shift. I've had this conversation with Professor Leif Edvindsen recently as well. I know there are a lot of economists looking at how do we move from GDP to a well-being economy. I've been talking to the good economy, for example. We've been talking about writing papers around the next wave, which is on economics, is around health and well-being. So maybe Ben, you could just give your thoughts on that, because you're really doing it.
May I just, then I...
Yes, go ahead.
The issue is, through technology, what we are doing, incremental innovation, basically in my country, for instance, in Italy, incremental innovation, doing better what we know already. We need to defeat incremental innovation. We need radical, disruptive innovation in human brain. It's very, very easy. If we don't do this, what we can do in our life?
Ben, radical innovation.
Yeah. In terms of, so if we look at the human brain then and adoption of technology, I think for many years, health technology have been touted as the panacea. Health apps and health technology have been around for decades. There are over 300,000 apps on the app stores for health, well-being, exercise, fitness. Health burden is getting worse year on year. Technology alone has not resulted in a shift in the dial of health and well-being. And the impact it also then has on GDP, because sick people are less economically active people as well. I think a really good example I've heard recently was of a company I've met based in Germany who are using radar and robots using radar to detect people in care homes if they've fallen over at night. Now, the technology works. It detects people, and they would send staff on the floor a message to say, you should probably go and check on this resident in this room. The behavior wasn't translating fast enough, because in a care setting, there are bells going off all the time. There's another incident, there's another warning. What changed the adoption of that was actually just having a human making a phone call to the staff on our staff on the floor to say, we've just had this detection. We think it's really important you go and check on this person. Humans and trust and creating that behavior to utilize and benefit from the technology is really important. And there is not one app that's going to be launched that's going to have a dramatic dent in health and well-being. There's not one piece of technology that's going to have a dramatic dent in health and well-being. We still need to think about the human involvement in the implementation and adoption and success success of technology. There is no limit to the amount of incredible technology being produced, but health burden continues to get worse every single year. So it's more thinking about adoption, implementation, and successful use with humans rather than technology being the savior in its own right.
Yeah, I totally agree with you. I mean, that's that needs to be addressed, and that's where I think the opportunity as well from an economic perspective is to create new and meaningful jobs. That's that human element won't be lost. We need that. I know at the moment we're struggling to recruit and retain staff in the health sector. We'll be short 18 million by 2030. But Shauna, your perspective, you're in this space, very technologically advanced area. What do you see digital health playing in terms of personalized medicine, and how can we support preventative care?
Yeah, absolutely. Those are really great questions. And as austere and as harsh as the spaceflight environment can be, I like to say that if you know nothing else about space medicine, it's simply that space is trying to kill you. A lot of the challenges that were mentioned so far in this discussion certainly hold true. So contextualization is key. And in fact, NASA has a very public, very searchable, you can do it right now, human research roadmap. And basically, if you Google this, you'll get this drop-down list of everything that can be a challenge to mission health, astronaut health, mission objectives, and mission performance. And, talking to this point about needing to contextualize and making sure that any technological innovation that we come up with needs to be actually something that will be used by the end user. A lack of adequate human, machine, and human spacecraft interface is very much one of those risks on a long duration mission to the moon or Mars. So that's the first point, is whatever innovation we have needs to fit within the framework as well as the uses. The second point is knowing how we think about health. And so I know that we're in a very global setting here and that we all subscribe to WHO standards, but to remind anyone out there, the WHO definition for health is not merely the absence of disease, but the presence of spiritual, physical, and psychological well-being. So to the earlier point about, it's human enhancement. Yeah, we should be thinking about how do we not just survive, but how do we let humans thrive in our most austere environments and resource limited settings, whether we're talking about, remote populations in Canada's Arctic, in remote Australia, or of course in space. So then coming to your question about where digital health can become specifically useful and applied to astronaut health, I think it's at every step of the way. So traditionally, when we talk about astronauts through the space agency route, their healthcare started with selection and with prevention, because, in space where things can go wrong, we'd want to mitigate the medical factor. So we are screening for the healthiest of the healthy, those who are psychologically and physically fit. And I've often said that the road towards becoming a space agency astronaut is also a bit of a medical genetic lottery. And so now that we see the rise of the commercial spaceflight industry, I myself am a commercial astronaut. I work very closely with my Canadian space agency counterparts, but I'm not a Canadian space agency astronaut. We're also going to have to look from prevention and selection to in situ treatment, and knowing the constraints of how we design for and pack for space. As I mentioned in my earlier response, we're mass, volume, power constrained. We can't bring it all with us. Being able to have crews perform autonomously. So when we're on Mars, we may have up to a 46-minute round trip delay, or even a 2 to 3 week communications blackout. So that's where digital health and emerging technologies such as AI can help crews perform more autonomously when it comes to diagnostics, when it comes to imaging, when it comes to not just meeting the standard of care on Mars as that we would have on Earth, but surpassing that and creating a new standard of healthcare.
Yeah, absolutely brilliant. And just Carl, from your perspective, I mean, you're sitting on quite a lot of boards and you've talked about your experience, digital technology adoption. This is what we're talking about. Let's keep in mind that 3 billion people don't have access to healthcare. So
Absolutely.
it's a huge field. What's your thoughts on this topic?
I took a leadership course, and out of this leadership course came a venture called the Space Innovation Alliance. And the idea was, how do we shift the whole consciousness around, I believe that, I am afraid that. On the one hand, you could take a look at the space is trying to kill me. On the other hand, you could have major breakthroughs, and not just from the defense sector into the commercial sector, but bringing people who have not been part of the equation. When you talk about a major shift and at the behavioral level, I think it really comes back down to belief. You can have all the technology, the processes, the data, and different components, but you really need to be able to shift belief. If you can shift belief, if you can get people taking a look at how this is actually going to be better for them personally, then all of a sudden you're able to have major breakthroughs. Like the AI company where I worked with, we did prescription pre-authorization. And what that helped to do was to save 10 to 15 hours per technician when you're taking a look at this medicine, this person's medical records. Should this person have this medicine based on these medical records, or is this going to help them or hurt them, right? And being able to do that. So once you can start getting around the behavioral aspects, now you start getting hit with, is more transparency the answer, or is it also healthcare literacy that's the answer? That's where AI on the healthcare literacy side can help with gamification, can help to be able to break down and create more of a bridge between different people, their understanding and what is possible. And then on the blockchain side, just because you can do something in space, do you have the authority to be able to do it? Or for that matter, anywhere. So people want a certain level of accountability. I was involved as a co-inventor on a patent for tracking and analyzing worker performance on blockchain. But part of our patent not only incorporated nanomaterials, which was one of my contributions into the mix, but also took a look at what was intended, what actually occurred, not just tracking the series of events. So what this allows you to do is to give more agency back to those that are participating in that type of system, and also navigate the regulatory so that you're able to arrive at that behavioral change and that shift for that preventative opportunity.
Yeah, brilliant. But I know what I really want to drill down, and I'll get everyone's final thoughts, because we've got about 7 or 8 minutes left. So I want to come to each one of you and just get a final thought. And Piero, maybe you'll pick up just on what Carl has been talking about. Mindset in terms of the future. You know, are you optimistic? Do you feel that digital health can play an important role in the, in terms of adopting new models of healthcare? You know, your One Health paper, for example. Love to get your final thoughts.
Optimistic. Saying this way, before I raised the issue of the culture of economic humanism. Now there is another side of this culture. Is the culture of conversation. Is a paradox that the social networks are not about a conversation. Conversation has been the origin of the Industrial Revolution, the lunar or moon society in Birmingham. And the same applies to the Enlightenment in France with les salons intellectuels de Madame de Paris. So we miss the conversation. We need to rebirth, to renew conversation, which from Latin, cum versare, means dancing together. And to dancing together, we need to be different. So we need transdisciplinarity, not intra, or multi, trans, which means a fusion of culture. This happened in the 1700s and the 1800s. You can read this very nice book by Professor Holmes called The Age of Wonder. We need the fusion of culture, the transdisciplinarity. And top to this, the result to my mind, if we follow this stream, is imagination, intuition, and empty space. There are a lot of space full of question mark. We need empty space where to create a new mindset, the augmented human beings. And when I say human beings, I say humans plus animals plus plants. The scientists have discovered that the so-called animals and the so-called plants are living organisms. Read the work of Capra, Friot Capra, and many other physicians and and the professor of physics. So this is my message. Economic humanism and the culture of a conversation.
Well, I quite like this cultural forming, and maybe Ben, given your insights into MSK, can we dance together? That's what I think Piero's saying. And bridging that cultural barriers, will that unlock a new economic model?
Yeah.
I think a lot of what to talk about is how we get people to engaging things. A lot of it's around behavior change, not just systems changing, but also individuals and clinicians, people living with health conditions changing. As humans, we don't always do what's in our best long-term interests. Hard work pays off in the future, but laziness pays off right now. We're really bad at future forecasting as humans. That heart attack you avoid is 20 years away, but that exercise session and that piece of cake you get to eat is right now. We're motivated so much by the things directly in front of us than further away. We're very irrational, but we're very highly predictable in the way we're irrational, and we can start to design strategies to overcome them. But everything we tell patients and people living with health conditions is based on the idea that we behave rationally. If we give them information, they'll process that information, they'll change their behavior as a result. Changing someone's mind with information is hard enough, let alone changing behavior of people with information. The feedback and learning I've had over the past few years is that when delivering services facilitated by technology in community spaces, where human connections are created with people knowing each other's names, stories, and motivations, you create social contracts and accountability between people. Where yes, the service is being delivered and facilitated by technology, but that is the element that has enabled technology to be effective, is the social contracts that it form organically between humans in a community setting and space. And I think leveraging that more, using strategies like gamification more, but it's that human connection which I've seen being really powerful to enable health technology to be implemented and used successfully.
Okay, brilliant. So let me just, Carl, we just lost you there for a second, but let me go to you next and then we'll finish off with Shauna. Carl, these new spaces, digital health, massive opportunity. We just had a really fascinating discussion around the cultural issues. How do we stitch this all together from your perspective, and does the future look bright?
I think if we can adopt that belief that it's possible with humans, technology, and data coming together, that we can get to a brighter future. If we can adopt that belief, going back to what everyone has talked about, then it opens up economic opportunities. Then it opens up the ability to authentically collaborate, the opportunity for radical innovation and new ideas, and even to use space as a laboratory for being able to discover those new possibilities together. But it really does come down to, are we willing to put aside labels and identities and other things from the past and step into a shared future together as equals, but also as individuals with individual gifts and talents that make up this wonderful labyrinth of humanity together moving forward?
Yeah, I love that piece that you just mentioned there, the authentic collaboration. I think that's critical. That's really part of what we need. We need a lot more leadership. Shauna, from your perspective, given what the field and the area that you're working in, digital healthcare, prevention, space medicine, artificial intelligence, is that a future that we can look forward to?
Yeah, absolutely. So I teach a class called Technology and the Future of Medicine at the graduate level at the university where I reside. And what I say to my students is this is the best possible time to be alive. The potential of not just all of these technologies that you mentioned, from AI to virtual reality, it's the intersection of these and how they can work together. And so, for anyone listening out there, now is the best possible time to be, as we said this session, radically innovative. And the best way to create that future that you have and that vision that you have for humanity is to write that vision for yourself and then go be part of that future. So create the future that you want to see, and then do it with like-minded people from all disciplines. We need all kinds of dancers, as Piero correctly said, and let's create that healthful future, both from the preventative side, from the predictive side, and even from the performance side that we all want to see, not just in space but also on Earth.
Yeah, I quite like that analogy. I like that vision. Let's dance together. I think on a Friday afternoon, we can all sign up to that. I just want to thank every one of you. Thanks, Piero, Ben, Shauna, Carl. Brilliant discussion. Really looking forward to working with you guys in the future. Hopefully in a few years from now, we can look back at this and say, this is what we envisaged. This is the future that we wanted to create for our children, for their children, and that we achieve it. I just want to say thanks to everyone who's joined this session. We'll be on in 15 minutes for the women's session. And from myself and the guests, thank you, and speakers, thanks very much. Thanks, everyone.
Thank you.